bulge can press harmfully against a nerve root.
I'm Dr. Jack from Comprehensive Pain Physicians. This is a second interview with one of my patients here, Daniel Simonette. Our initial interview was before his spinal cord stimulator trial and implant, and now Daniel is back so we can interview him and understand if he's had any improvement in pain and function after his spinal cord stimulator implantation.
I've done well. It's been about 3 weeks. The first week was a little bit rough, just mainly from the surgery and being able to lay on my back or move around, but that quickly subsided. I've gotten back into my life, being able to do gardening and working out at home, and feel like I'm getting back to where I was almost before 10 years ago.
Prior to your spinal cord stimulator implant, you were having pretty severe pain in the lower back and into the legs.
Yeah, even with the morphine and the hydrocodone and at one time Oxycontin that I was on,
Sure.
I was still on a pain scale of between a 6 and a 9 daily.
And now, how would you rate your pain scale?
I'm on my worst, I'm up to about a 4.5, 5. On my mornings when I wake up, I'm about a 2 to a 3. Again, I did 6 hours of weeding and gardening last Thursday. I carried some mulch bags around. I was up and down on my knees all day. The most I could do would be an hour before that, and that would be to work 10 minutes and then sit for 20.
Right.
Now I'm working 30 minutes and I sit for 10.
Good.
Just to take a break.
Good.
And I'm feeling really good. I'm up to walking. My steps before the trial stimulator or the stimulator was I was only averaging about 1,600 steps. I'm averaging 6,000 steps a day now.
Wow.
I have a Fitbit that counts them for me.
Wow.
So the 6,000 steps I took yesterday was on top of the aerobics in the water and the knee lifts. I am not really able to swim yet. The stroke of coming around is too hard on my neck.
Sure.
But to actually be in the water and to do knee lifts, I did 1,300 knee lifts to 45 minutes of aerobics in the water, and then was able to get into their hot tub and relax in the saunas.
How many knee lifts could you do prior to the implant?
I wasn't trying to do any. Before last September in my pool at my home, I started out at 50, was getting up to 500, and that was a good day.
All right, so another aspect of improvement or response to the spinal cord stimulator system is use of medications and specifically use of what we call opioids.
Mm-hmm.
So how much medication were you using before the surgery?
I was taking 30 milligrams twice a day of the morphine and taking...
The long-acting extended release.
Yeah, the
right?
extended release.
Right.
And then taking, for onset pain, hydrocodone. Is that?
Oxycodone.
Oxycodone, sorry.
Okay.
I was taking that, and it was 20 milligrams, and I was taking between 3 to 5 of them a day,
Okay.
and still ranging in a 6 to 8 pain range, and not able to do things. It hurt me just to get into a car, to sit down, to get up, and then the side effects of the drugs. I was a little bit not stable. I walked with a cane to give me a 3-point, position to help me move. And since then, I've been weaning myself down, but I'm on, with, of course, the doctor's recommendation, but I'm taking a 15 milligram twice a day, one in the morning, one at night, so 30 milligram total. And then I'm on hydrocodone. Yeah, Norco, that's 10-3-2-5, and I'm down to only taking 2 of those a day.
So that's actually more than a 60% reduction in both the morphine
Every bit.
and the short-acting.
And I feel better. I'm clearer in my head.
Right.
I feel better physically, and my pain scale still ranges from a 2 to a 5.
Good.
5 only at the end of the day after I've exerted myself throughout the day.
Right. You've achieved considerable improvement in your pain scores. You've
Absolutely.
achieved considerable improvement in function.
Right.
Considerable reduction in the use of pain medications, especially the dangerous opioids. And you also told me your mood and sleep has also improved.
Yes, I'm sleeping comfortably. I used to only be able to sleep on my side with a large pillow placed under my knee and then kind of laying on it. And now I'm able to sleep in 3 positions, which is my back and either side, which is a lot more comfortable. I'm enjoying my life back more. I'm getting more of my life back. I've actually shot basketball, which I've not been able to do for 10 years. I beat a guy in 2 games of horse. So.
And how difficult is it to operate the spinal cord stimulator system?
Very simple. It's very simple. I have tried changing the program to see if I can get any more relief. And actually the program I started out on is the best program. It's program 1 at level 4.
Good.
And there's a remote control that shows you how much your battery charge is at, shows you what program you're on, and shows you that it's actually turned on.
Show our viewers what the Incision looks like.
Show the original scar.
The original scar is actually right here. Then his incision is a little bigger than normal. Probably say this is about 8 centimeters long. Usually my incisions for this procedure is usually about 4 to 6 centimeters. It's bigger than him because he's a bigger guy.
I'm actually 6'2", 370.
Right, he's a bigger guy, so it's a little bit more challenging to put in his stimulator. Now, this incision here is where the medical wires go into the spine, and the medical wires are connected to a battery, which is right here. There's a battery that powers the medical wires, which are placed in here, and these medical wires are connected to the battery through leads that are tunneled under the skin into this pocket here. So again, he has 2 incisions. The middle incision is for the medical wires that go into the spine, and this incision on the buttock here underneath the belt line is for the actual generator that powers the medical leads to eliminate or modulate the pain signals that go from his legs and back so that his brain perceives absence of pain. Now, this doesn't mean that he will not feel pain if he were to have a traumatic event such as a fall or or if he were to get hit in the back. He would still feel that sort of pain. But pain from everyday activities such as walking, standing, is significantly reduced by this system. The second incision you see here on the left buttocks from here to here is for the battery that powers the medical wires. This battery is connected to the medical wires underneath the skin here. So the wires are tunneled from this incision to the battery under the skin. Obviously, we're not done yet. You have some other pain generators, including your neck and hip, which we're going to work on. So for the viewers out there who'd like to learn more about spinal cord stimulators and neuromodulation, we have a lot of information on our website, cpppaincenter.com. We have both literature and videos that explain the procedure and indications in great detail. Thank you.